Today's webinar is with Apria Healthcare called Predictive Analytic Insights for an Optimized Revenue Cycle. Apria Healthcare, a leading provider of home respiratory services and medical equipment, realized that there was an opportunity to improve the efficiency and effectiveness of its patient billing and collection efforts, and deployed Conance's predictive analytics technology and innovative workflow strategies into its existing infrastructure for immediate and sustained performance gains. During this webinar, you'll learn how Apria increased productivity, reduced costs, and realized an annualized cash improvement of more than $8.5 million with Conance's patient pay program. Today's presenters are Steve Bernard, who is the Vice President of Professional Services here at Conance. Conance transforms the financial performance of healthcare providers through predictive analytics, technology, and advisory services. And the featured presenter today is Claudia Muriel. She's the Vice President of Patient Pay Operations at Apria Healthcare. Apria Healthcare provides home respiratory therapy, home infusion therapy, and home medical equipment services through approximately 520 locations in the United States. With $2.4 billion in annual revenues, it's one of the nation's leading home health companies.
Good morning or good afternoon to everyone. This is Claudia Muriel with Apria Healthcare. And I'd like to talk about the Apria Opportunity Assessment that will provide an overview of the state of operations prior to Apria working with Conance, and will also summarize some of the key findings from the original assessment they did. Now, Apria's collection operations profile with focus on the patient pay component. Historically, we had limited investment on patient collections. With changes in reimbursement rates and shift to patient out-of-pocket expenses, Apria identified the need to evaluate the patient pay process and to look for opportunities to improve collection performance. Our current structure, or Apria's patient pay organizational structure, we have 2 call centers located in Tennessee and Ohio, and some of the portions of our process are currently outsourced. Now, prior to Conance's patient pay operations had a dedicated center to service, you can see here on the bullet points. We had extended dunning strategy, so all patients were pretty much treated the same. We had 1 collection agency or bad debt agency, no secondary bad debt. We had an aging dialer. We had underperforming average agent talk time and wrap times, very high hold times. And then we had a one-size-fits-all workflow and a one-size-fits-all schedule of calls and letters. Now, Conance came in and did an assessment, and the assessment and opportunities identified were really due to the lack of visibility of metrics, lack of benchmarking and accountability, which all could be obtained by the comparative analysis, predictive analysis, and system optimization that Steve just talked about. But we found the most impactful opportunity areas were the existing vendor was underperforming and overcharging as compared to the industry benchmark. We found that the internal collections group was underperforming while experiencing a relatively high cost to collect. We had poor reporting with limited visibility to true performance internally and externally, and standard and inflexible internal collections process resulting in an excessive cost to collect. Once we identified areas of opportunity, Conance was able to provide recommendations on optimizing Apria's patient pay process. Well, I'm going to review some of those opportunities. If you look at just the data analytic and driven decisions, I'm using more detailed data, reports, graphs with trends, allowed for decisions based on the data and trends and what we were seeing. And we were able to identify some internal operational inefficiencies. And we were learning from Conance's internal collection operations expertise. We were implementing performance measures process, and we were leveraging Conance's predictive patient pay analytics. And this helped us to drive and make more decisions based upon the information that we were given. If you look at the improvement of optimizing the business partner relationship when it came to the collection agency and the bad debt, we implemented Conance's agency manager platform to manage the flow of accounts to Apria vendors and to utilize standard vendor performance measures and actively manage business partner relationships. And this gave us live visibility to what was going on. We could see where each agency was, what their collection efforts were. It was something that we were missing before, and we were able to hold them more accountable and be able to benchmark to where they needed to be performing. This slide provides a timeline of the project. And the patient pay optimization engagement with Conans began, as you can see, in late 2011 and continued to ramp up through the second quarter of 2012. Apria continues to engage with Conans through the agency manager platform and ongoing business partner performance management. And Steve will now provide some additional detail on the respective components of the initial patient pay optimization engagement.
So I think Claudia mentioned, analytics was the tenant for much of the engagement between Conans and Apria. Analytics to drive really two things, right? It's internal operational performance within their internal collection effort for patient balances, and then better management of their business partners. So really looking, if you think about it, we're really looking at the entire patient pay, post-discharge patient pay. We believe as more and more entities are using outsourced service providers to handle their revenue cycle, in some cases to handle all of the revenue cycle, we believe that there's going to be a greater and greater emphasis on revenue cycle entities' ability to manage those relationships, and manage those relationships both in terms of performance management and general workflow management. So when we look at the internal operational effectiveness, Conans did a holistic overview leveraging existing data to prioritize where there were performance breakdowns both based on internal goals and objectives, but also as compared to industry benchmarks and experience at other clients with Conans, to identify just kind of where are the heavy hitters, where can we make the most impactful change in the shortest amount of time. Really reinventing the IVR phone tree was one of the major changes that was implemented. Also looking at enhancements of call logs. So really giving visibility into exactly what was happening on the floor at the agent level, giving us much more visibility to the overall operational performance. Historically, Apria had been focused very much in terms of performance measure on financial, so looking at cash, looking at AR, looking at bad debts, just the standard financial metrics that obviously are the tenets of these organizations, but really taking it down and looking at the operational metrics that drive those financial benefits. Making some changes in terms of sequencing and timing, looking at time zones and optimizing the workforce to knowing that Apria is a national vendor and therefore has patients and customers in all time zones. Reinventing the scripting. There was quite a bit of variation in terms of how agents were doing their talk-offs, the scripts that they were using. There were best practices implemented at the time, but not uniformly. So moving everyone up to that best practice, monitoring and QAing based on that, had a lot of impact on execution and overall patient satisfaction. Most importantly was the performance management tools that were implemented. I talked about really looking at operational metrics was a key. The standard stuff like talk time, speed to answer. Let's face it, if you can increase speed to answer, so therefore you're reducing the number of lost calls, right? People hanging up. Then you can move on to reducing talk time. So if you reduce talk time, you're able to service more calls with the same staff. If you service more calls, you're going to have more of those calls or more quantity of calls that result in some sort of collection or resolution of a balance. If you have more collections, then you therefore obviously improve cash, decrease AR. So really looking at those operational metrics that feed to the financial metrics was a key part of optimizing the own internal operations. And then finally is using segmentation to drive the letter volumes. And this is where we get into more of these predictive analytics that really drove some incremental benefits for Apria. So I think I talked about predictive analytics a little bit. In terms of how Apria was able to leverage this, Conant does offer a predictive analytics suite focused exclusively on the patient pay. And what we do is we look at Apria's historic payment behavior of all of their customers and patients and invoices. We also look at the de-identified data of all of our customers. So we maintain a de-identified database of payment behavior based on variables that span far beyond what you would traditionally look at when trying to find trends for patient behavior. And this also speaks to, when we do predictive analytics, having this very robust and rich data set is what makes it that much more meaningful and accurate. And then finally, the third piece of our predictive analytics is this third-party consumer behavior data, which we are able to obtain because we have an exclusive partnership with FICO that gives us insights into data that would never be available, let's say, to a standard DME supplier or health provider, in that we're talking about publicly available information on patients, such as their utility bill payment behavior, the fact if they own real estate or not, their employment status, all of these things that have no impact on credit data. We're not looking at credit data. We're more looking at consumer behavior data. So this data, when we put all these three pieces together, it allows us to plot a patient on this 2x2 of patient repayment behavior and the amount that they pay, the expected cash value. So by plotting patients on this 2x2, we develop clusters, and clusters are groups of encounters that have similar characteristics. Those similar characteristics allows us to define workflow, the appropriate workflow. And in this case, the appropriate workflow was the sequencing, timing, and frequency of Apria's statements. So I think Claudia mentioned before, when we started, statements were going out to every open balance every month for every encounter. So as you would assume, that's a very, very high statement spend, much higher than what we would typically see given the nature of the business. The predictive analytics allowed us to tailor that so that we were sending statements at the right time, frequency, and volumes depending on that cluster, that type of patient. Was it a patient that would benefit from an investment of multiple statements? Was it a customer or patient that we could send one statement to and pretty much assume that they would pay after that one statement? Or would this be a conserve effort where we would send the necessary statements, but then we would stop because we would know that any additional statement that we would send would fall on deaf ears? It would be a wasted cost to the organization. So moving on to the next area of focus was on business partner engagement, and this really is kind of synonymous with vendor management. Vendor management is a key piece of what Conant does. We look at vendor management in kind of 5 pillars: performance management, inventory management, managing productivity, managing those exceptions. Exceptions are just kind of the one-off processes that are often unique to the organization, and then just general process improvements. So when we look at performance management, we want to be able to accurately compare netback collections. We want to look at the segmentation analysis and just general performance comparison and have an accurate view of how the vendor is performing. And what we don't want to do is we don't want to rely on the agency or the vendor to communicate their performance. We would advocate that the organization that is contracting with the vendor is the one who is defining performance and measuring it. There's inventory management, and this is if you're familiar with the patient pay, patient collections process, this is a big one. Accounts end up sitting out with a vendor longer than they should, or we inadvertently place to multiple vendors at the same time. We have stuck balances, or we have reconciliation problems. Big piece of vendor management. Productivity is the one that's really a differentiator here for Apria. It's looking at actual collection activity and being able to ensure that the accounts that you turned over to your vendor are being worked as you would like them to be, as you would have assumed and as you would have stipulated when you originally set up a contract. Looking at collection activity, this is where at first blush you might say, well, we turned over our balances so that we wouldn't have to manage productivity and collection activity, and that is a fair statement. But what we advocate is that you focus on ensuring that your expectations are being met, and when the vendor is deciding not to, let's say, invest in the collection effort of a subset of accounts, that you're aware of that. Managing the exception processes. So using, Claudia mentioned, the implementation of Agency Manager. This is the tool for managing the workflow and communication between the vendor and Apria. And finally, is a diligent monitoring and management of the general processes. So a little bit more about the platform. Agency Manager is a piece of software technology that is used for passing information and acting as the go-between between all of Apria's vendors, revenue cycle vendors, and Apria's revenue cycle organization. When we look at it, it is a tool for managing the inventory. So that's placements, recalls, reconciliation, and tracking. Performance management, as I mentioned before. Looking at the exceptions. So exception processing is often the Achilles heel of a lot of these relationships. One size fits all is not something that is conducive to this industry, as we all know. So integrated work queues to help handle those handoffs and allow for tracking of communication between the two vendors. Apria also took advantage of the commissioning calculations, so no more auditing of invoices and asking for credit memos. It's all handled in an automated fashion directly within the platform. And really using the Agency Manager platform to manage multiple types of agencies. So when it comes to performance management, the tool, the Agency Manager platform was also able to bring lots of standard reports, canned dashboards that made it very clear and concise on the articulation of performance. So beyond these tools that were brought to bear, Conance was very much involved in the actual management of the vendors on a daily and monthly basis. So really instituting monthly vendor performance reviews, and with the real focus of providing mutual visibility to performance. So sharing this information with the agencies if they're in a comparative situation, champion challenger, giving both agencies visibility to the other's performance. And a lot of agencies will, if you've ever had that discussion before, often an agency would be immediately concerned that they're not defining performance in the same way, and that discredits the actual comparison of performance. And in this case, since it's being managed within the Agency Manager platform, there is no debate. The calculation and methodology used to calculate performance is going to be the same. So really looking at and optimizing Apria's internal operations, making or enhancing the vendor relationships, and really managing these vendor relationships as if they are an extension of the internal revenue cycle, and leveraging of these predictive analytics is really what drove some of the pretty sizable benefits that Apria experienced that Claudia is going to take us through right now.
Thanks, Steve. So we've gone through and reviewed, what Conance has done for us, what were some of the issues, what was our state before, and now I'm sure everybody wants to know, well, what did that really do for us? And talking about return on investment and what implementing some of these changes has done for Apria, we really want to divide it out into two areas. We had our early out collections, which we saw a 12% increase, and really tied to the IVR phone tree strategy that Steve spoke about, some call scripting and operating metrics management that we put in place. And then there was the bad debt component. Talking back about the early collections, I think the most significant benefit came from the improvements experienced within Apria's internal collection effort. While you heard about the numerous operational improvements that were implemented over the course of the engagement, the true value comes from the diligent monitoring of operational performance. I think having the reporting on the metrics and being able to hold people accountable really drove some of that performance improvement. It is the analysis of performance data and metrics that identified and prioritized these operational improvements, and it continues to do so going forward. When we start to look at our bad debt, not having a secondary bad debt was one of the biggest changes, and then creating a champion model, a challenger model, where you have two agencies competing against each other to see who has the better collection or recovery rate. I think that helps to drive some of that and continuous effort of continuous improvement that we continue to do with our relationship with ConAMS. We're looking to add even a third agency to add to some of that additional challenging champion model, and not just for the primary but as well as the secondary. As you can see, there was an 8% increase in primary bad debt recoveries and an additional 2% on the secondaries. And the difference between primary and secondary, if you're not familiar with that, is you place a set of a book of patients with an agency, and you give them a certain amount of time to collect on it, and if they haven't been able to collect on it, you then transfer that book of business to a different agency who will take a stab at collecting on that book of business. With primary bad debt, while ConAMS was helpful in identifying and implementing best-in-class agencies, it was and continues to be the ongoing management of their performance that has the most material impact. Again, metrics and holding people accountable to those metrics. And secondary bad debt, the only benefits above the primary bad debt solution was that ConAMS identified that Apria could benefit from a secondary bad debt solution, which one didn't exist prior to our relationship with ConAMS. Now, in addition to our collections being increased, we also experienced some benefits that were non-cash related. As you can see, by reducing our number of statements and focusing on key patients based upon all the different criteria that Steve reviewed, we had some significant reduction in our postage expense because we had letter cost reduction. We were mailing less statements, less letters. We also improved our phone metrics. We had lower wait times, lower abandonment rate. And then overall, our billing and collections costs substantially were improved. We had better netback, even though we experienced higher contingency fees, just based overall because of the higher collections. It should be noted that making significant performance improvements is not something that happens overnight. It took several years, as you can see, since 2011, and we continue to make improvements today. And can begin to erode the moment that you enter into a steady state if you don't stay on it and continue to hold people accountable to it and continue to measure and identify additional opportunities for improvement. The key to achieving and sustaining such benefits is bringing in a partner like ConAMS that has deep experience in the internal and external collections network and empowering the team to better leverage data to drive continuous improvement.